Hi, I'm Dr. Troy Robin Hailparn of the Cosmetic Gynecology Center of San Antonio. And many women develop problems with orgasms over time. And sometimes we want to know why. What are the reasons that this can happen? So one is anatomy. Sometimes women can develop adhesions that can mat down the clitoris and make it inaccessible, make it harder to stimulate. So anatomy is really important to assess when trying to figure out what's going on if you're not receiving the pleasure or responding like you used to. Hormones is the second thing that we want to evaluate. Estrogen and testosterone both drive desire, arousal, and response. And so making sure that your hormones are in the right ranges is really important. And the good news is hormones can be supplemented if they're low. We also want to assess blood flow. Blood flow helps with arousal and response. And so to make sure that there's adequate blood flow to the area is really, really important. And then brain function. Our hormones, and we have chemicals in our brain, serotonin and dopamine, and they also impact our ability to be aroused and to have desire. And so if these levels aren't high enough, we have now medications that can stimulate the brain and help with that kind of response. And lastly, what we really don't have as much control over is our relationship with our partner. Because for women especially, there has to be that brain closeness, that emotional connection to help with the whole response. So when one is evaluated, you want to look at all of these things. And if you have questions, it's good to ask them. Now, there's some really new technologies available, treatments for you. For the brain hormone stimulation, we have something called Addy now. There's only 2 medications that exist for women who have low sexual drive, and this is one of them. And it helps with the dopamine and serotonin release in the brain. Okay, for blood flow, we have a wonderful new topical product that's called O2 Vasc, and it has 4 natural vasodilators, and it's put on once a day for 2 weeks, and it helps increase blood flow and response. Also for women that have issues with orgasmic dysfunction and problems with arousal, the O-Shot, which is platelet-rich plasma, has been shown to help some women. This can be really good with stimulating the response. And so we have lots of tools in the toolbox that we can use to help figure out what's going on with you if your body's not responding the way you want it to.